A recent study conducted in the US has discovered that 1 in 10 individuals develop long COVID after being infected with the Omicron variant, and researchers are now beginning to identify key symptoms associated with this phenomenon. A study of almost 10,000 Americans suggests that the occurrence of long COVID among individuals post an Omicron infection is estimated to be around 10%, which is a lower number than what was anticipated earlier during the pandemic. The study aims to assist in understanding the enigmatic condition. The National Institutes of Health study has revealed a list of 12 symptoms that are particularly indicative of long COVID, a term used to describe the persisting health issues that can last for months or even years following a mild case of COVID-19. Long COVID has affected millions of people globally, exhibiting a multitude of symptoms such as exhaustion and mental confusion that can differ widely from person to person. Despite extensive research, the causes of this condition are still unknown, and there is no clear understanding of why it only affects certain individuals, nor is there a consensus on the most effective way to diagnose or treat it. Accurately defining the condition is essential for researchers to develop effective solutions and provide answers to the many questions that remain. According to Dr. Leora Horwitz of NYU Langone Health, who is one of the authors of the study, there are times when she hears people say, "Oh, everyone gets a little tired." However, she emphasizes that individuals who are experiencing long COVID are experiencing something different, and it's imperative that we recognize this. In a recent publication by the Journal of the American Medical Association, over 8,600 individuals who had contracted COVID-19 at various times during the pandemic were compared to 1,100 individuals who had not been infected. Long COVID is said to affect around 33% of COVID-19 patients, according to certain estimates. This figure coincides with that of participants in a study conducted by the National Institutes of Health, who fell ill before the Omicron variant was identified in the United States in December 2021. It's worth noting that the study began at that time, and that people who were already experiencing long COVID symptoms may have been more likely to participate. During the study period, approximately 2,230 patients contracted coronavirus and were able to report their symptoms in real time. However, only a small percentage, around 10%, experienced long-term symptoms lasting up to 6 months. Previous studies have indicated that the likelihood of experiencing long COVID has decreased following the emergence of Omicron, but its offsprings are still being disseminated. Identifying and providing assistance to those who are already experiencing long COVID is the more significant challenge. The recent study focused on identifying 12 key symptoms that could potentially serve as markers for long COVID, including fatigue, brain fog, dizziness, gastrointestinal issues, heart palpitations, sexual difficulties, loss of smell or taste, thirst, chronic cough, chest pain, worsening symptoms post-activity, and abnormal movements. To ensure consistency in studies related to long COVID treatments, the NIH researchers assigned scores to patients' symptoms, aiming to establish a threshold. This would help in identifying similar patients who would be eligible for such studies, facilitating fair comparisons across different studies. According to Horwitz, it is important for doctors to understand that the list of symptoms related to long COVID is not meant for diagnostic purposes. Rather, it serves as a possible tool for research. Patients may exhibit a single symptom from this list, multiple symptoms, or even experience symptoms that are not included on the list. Regardless of the specific symptoms, it is possible that the patient is still experiencing long-term effects of the coronavirus. According to Horwitz, although many people are conducting studies on long COVID, the term itself remains ambiguous and undefined. To support our channel's growth and ensure broader awareness, kindly hit the like and subscribe buttons. This will help us reach more individuals and disseminate valuable information. Thank you in advance.